because we know so many diseases, we need a scalp acupuncture give treatment. How to do it? So we name from these parts. Last part is precaution. That means we do scalp acupuncture. We need to pay attention something. We need to careful do something. This is last part we talk about. Now we go back. First parts. First parts we did name. Why do we study scalp acupuncture? Why? No just scalp acupuncture or different scalp acupuncture. No, what is international scalp acupuncture? Compare another scalp acupuncture. What is good points? What is weak points? Another safety treatment. This is first part. So now we know what is scalp acupuncture. We know scalp acupuncture is therapy, is treatment to prevent or treat disease by the literally spatial stimulation area of scalp. So that means scalp acupuncture we can use to treat disease and prevent disease. Treat the spatial stimulation area on the head. So before some people ask, before we do the body acupuncture have so many points on the head. So that means we do the head points. This is a scalp acupuncture. Answer is no. This is still is called body acupuncture. It's not a scalp acupuncture. So that means the body acupuncture or scalp acupuncture, what is different? So the body acupuncture, we choose the points on the whole body. Look like do 14 on the head. Precardial 6, we choose this point on the head. Liver 3 on the feet. Gallbladder 34 on the neck. So on the body, different parts we can choose. But the scalp acupuncture are taken on the head only. Look like MS1 on the head, the front. MS10 on the head. So this is different. Location is different. Scalp acupuncture points on the head only. Body acupuncture can choose whole body. Second, body acupuncture point is a point. What does this mean? So look like you be first, you do only one small area. Stomach 7, you do just one small area. Is on the points. Scalp acupuncture point is 9 or area. Is not a point. So look like, I give you example. MS5. So these points is scalp acupuncture points. Is from the Du 20 to Qian Shen Cong, this area. Du 20 to Qian Shen Cong. Everybody know how long about this area. About 1 寸, 1寸. So that means scalp acupuncture points. So from Du 20 to Qian Shen Cong, the 1 寸area or line, this is scalp acupuncture points. Another MS8. MS8 from UB7 along the UB channel 1 to 1.5 寸. Is this line or this area? This is scalp acupuncture. It means 1 寸 or 1.5 寸longer. This line or this area is called scalp acupuncture. This is second different. 3, the method of insert the needle. We do the body acupuncture. We have insert the needle have different angle. Insert perpendicularly, insert obliquely, insert horizontally. 3 methods. But the acupuncture on the head, the skin is very thin. It's very thin. So then we do scalp acupuncture. We do horizontally insert the needle only. Only. So from this information, we know the scalp acupuncture. So compare both the acupuncture is different. On the head, whole body. On the point, on the line. On the perpendicularly, on the 3 incision. This is different. So for this, why do we study scalp acupuncture? We have body acupuncture. Why do we study the scalp acupuncture? Because useful. Because useful. So the scalp acupuncture points on the area of head. So it is mainly used to treat cerebral disease or nervous disease in the clinic. Scalp acupuncture compare body acupuncture. For the brain problem, nervous problem, have more good result. This is why we say we study scalp acupuncture because more useful. Compare the body acupuncture. Treat the brain disease, treat nervous disease in the clinic, you can see have good result, have good result. So look like, so we list about the disease, but not all, just some. So we know body acupuncture can treat so many diseases, but the scalp acupuncture, you see, mainly for the brain issue, brain issue. Look like first we see stroke, but now acupuncture treat the stroke is more popular. Is more popular. Many patients go to say acupuncture or Chinese medicine. But if plus scalp acupuncture, result should be much better. Result should be much better. Another senior dementia, Parkinson's disease. This is a brain issue. ALS. ALS, this disease, you know. So it's brain or nervous issue. This disease is progressive degenerative disease. What does this mean? This disease is slowly get worse. Slowly get worse. Most people life around about 3 years. 3 years. But in the early stage, you don't see so many symptoms. Don't see so many symptoms. Fear arm or leg may be little weakness. And the speaking may be later difficult. And the swallow later uncomfortable. For early stage, you use scalp acupuncture, use Chinese medicine, give treatment, can slow down or stop this disease develop. Slow down or stop the disease develop. They can save the people's life. But if you go to lower stage, so you treat, not good result. Treat is early stage. Early stage. So I saw so many this patient ALS. If treat earlier, all have good result. All have good result. So this is about ALS. Epilepsy. Epilepsy, this disease, use scalp acupuncture, have good result. Have good result. Can reduce the disease flare up the time. Can reduce the disease symptom level. But this epilepsy treatment usually is year by year, not short time, not short time. Another multiple sclerosis. Multiple sclerosis. So this is a brain issue. You can see brain is different parts have so many issues. This is usually do MRI check fine. This use scalp acupuncture. Can slow down this disease, or some case can cure. For Western medicine, this is no cure, but the Chinese medicine get a treatment. Some case can cure. Some case can cure. So this is multiple sclerosis and concussion. Concussion. So in the clinic, we see so many. Some people after car accident, after injury, after cause the people, the brain shock, fear cloudy, fear space, hard to concentration do something. For this disease, use acupuncture or scalp acupuncture treat. It is good. It is good. Another brain injury. After patient get an injury, get a car accident, get a surgery, have side effect. Have side effect. Before we saw one patient, she come my clinic after surgery, but it's not a brain surgery, it's body surgery. After surgery, she has hands shaking, both hands shaking. So both hands shaking, so shaking cannot stop, cannot stop. Once the doctor gives stop shaking the medicine, from 3 times increase to 5 times, increase to 5 times. But the shaking is still there, cannot stop shaking. So when she come to my clinic, she hands always shaking, always shaking. She say almost whole days cannot stop. For this disease, I do the scalp acupuncture on the head. Then I do a few points on the hands, on the arm. So quickly on the leader, on the body, the shaking stop right away. Shaking stop right away. So she's so surprised. She's so surprised. So because she have this shaking almost 3 months, 24 hours, 7 days, 1 week. The shaking continues 3 months. But use scalp acupuncture, use a body acupuncture to together. So the shaking stop. She almost cried. She said, "You are God." I said, "I'm not God. I'm God assistant." So from this, you can see scalp acupuncture. We treat so many severe disease, the brain problem. So I list about this, just the parts, not all. Actually, scalp acupuncture can use so many severe disease. Severe disease. So once used for the brain, so then scalp acupuncture we can use for the nervous problem. Nervous problem. So what kind of problem? So for migraine headache, everybody know migraine headache make the people. It's so painful. It's so painful. We use scalp acupuncture. We can stop the pain. We stop the pain. So for this, we treat so many migraine headache. So have very good result. Have very good result. But the point is migraine headache. So when the pain stop, we still need to do some tune-up. Look like you treat about a few times, headache stop. But we still need to do tune-up. Cannot stop so early. Stop so early, the pain can come back. So depression or anxiety. So scalp acupuncture, we treat so many depression, anxiety, or emotion problem. So this is have good result. So look like we often use called middle flower, treat depression, anxiety. The patient feel very good. After treatment, feel release. So emotion feel more positive. More positive. Another for insomnia. Scalp acupuncture, we know body acupuncture can treat insomnia. But the scalp acupuncture can treat hard to treat insomnia. So some insomnia use body acupuncture have good result. But some insomnia, even though you use body acupuncture, don't have good result. For this, we try scalp acupuncture. So then we can feel the treatment result get improved. Treatment result improve. Another tinnitus. Tinnitus. So this is terrible disease. If tinnitus mild, so many treatment can help. If tinnitus is so loud, we plus scalp acupuncture have good result. I remember I treated one person. So he has tinnitus. So say, with the doctor get treatment, feel a little better. But the tinnitus is so loud, look like live in a highway, live close to the highway. So he cannot sleep, he cannot working, he cannot do anything because the tinnitus is so loud. Then I give treatment. I plus scalp acupuncture. So treat about 6 weeks. Tinnitus is gone. So he's so happy. He's so happy. But for the tinnitus treatment, should be early. Some people say, Dr. Zheng, I have tinnitus 2 years, 3 years, 4 years, 5 years. Can you help me? Yeah, many years tinnitus. The answer is no. Tinnitus treat very best window is 3 months to half year. The best window. In this window, you get treatment tinnitus, or is reduced or it's gone. So if over 1 year, tinnitus is hard to treat. So this is why 2 years, 3 years, 4 years, 5 years, tinnitus is very hard to treat. But maybe you have little better result. But generally speak, so change is not too much. Another paralysis. Paralysis, we can see different disease cause the paralysis. Some is due to numbness, tingling cause paralysis. Numbness, tingling. So some people say come to clinic, say I have some numbness, tingling on the leg and the arm. So scalp acupuncture can help. But some people say, oh, I'm so busy, so little better numbness or tingling. It doesn't matter. I can tolerate. Okay. So you can tolerate, but with the time, many years after, you can see your arm, your leg, and shrink. Compare normal, no numbness, no tingling. You can see one is bigger, one is smaller. If continue, can cause the leg, the arm is more weak. It's more weak. So for this, once you have this numbness, tingling, should be get treatment. Don't wait. Don't wait. Wait in the future is not bright. It's not bright. Another we can use called IBS treatment. What is IBS? Irritable bowel syndrome. This disease in the clinic is very often. Suddenly, diarrhea, suddenly constipation, sometimes feel pain, sometimes have gas bloating. For this problem called IBS, IBS, irritable bowel syndrome. We can use scalp acupuncture. This disease usually due to the emotion. Emotion problem cause IBS syndrome. So if we use scalp acupuncture give treatment, can improve the patient emotion, then we plus some body acupuncture can cure this disease. IBS, bad treatment may be later longer, not short time, not short time. So because scalp acupuncture can treat cerebral or nervous disease, and the result is more better. This is why we need to study scalp acupuncture. We study scalp acupuncture. Before I talk about it's useful, it's useful. So we use scalp acupuncture to treat the brain or nervous issue, but we still use scalp acupuncture to treat whole body disease. Whole body disease. So similar look like a body acupuncture. Look like a MS2 can use treat upper jaw disease. Upper jaw disease. So this is means lung or heart problem. Lung, heart problem. Severe, look like a severe cough. Severe cough. So look like heart problem, chest pain. Palpitation. Palpitation and chest pain. Irregular heartbeat. Or about this or disease, we plus scalp acupuncture. Result is much better. Result is much better. So this is why. So we use scalp acupuncture to treat a brain issue, treat a nervous issue. Then we use scalp acupuncture. We can treat a whole body issue. You see, scalp acupuncture is more useful. It's more useful. So scalp acupuncture is more useful. But we need scalp acupuncture, we know scalp acupuncture is come from traditional Chinese medicine. Come from acupuncture and mask busting. Come from Chinese internal medicine. Because we know many different channel go to the head. So look like 12 the main channel. 12 main channel. How many channels go to the head? So 12 channel, we have 5 channels go to the head. So 5 channel go to the head. We have a stomach channel go to head. We have urine blood channel, stomach channel front, urine blood channel go to head. We have Sanjiao channel, liver channel, gallbladder channel go to head. So 12 main channel, we have 5 channel. We have 5 channel go to head. Stomach channel, urine blood channel, Sanjiao channel, liver channel, or gallbladder channel. 5 channel go to the head. The 8 extra channel. So how many go to head? Have 3. Have 3. Dual channel, Yangqiao channel, Yangwei channel, extra channel. We have 3 channel go to head. So this is why so many channels go to head. So then we use scalp acupuncture can treat large channel disease. We know. So the scalp acupuncture, the base come from the base is traditional Chinese medicine, acupuncture and microsystem internal medicine. The base is from here. So, but the scalp acupuncture has developed on the base and become the new treatment. So the scalp acupuncture still reflect theory and characteristics. So still you can see scalp acupuncture. So you have traditional Chinese medicine or acupuncture, so many information. So many information. So many scalp acupuncture points. We can see many scalp acupuncture points on the regular channel. Many scalp acupuncture points on the regular channel. So look like we see we see the MS1. You see the picture. MS1, the points is on the UB channel. Is UB3. MS2 is on the UB channel. MS3 is on the gallbladder channel. MS5 is on the dual channel. So you can see so another we can use the channels function. according to the theory of traditional Chinese medicine, gallbladder, liver, they function for emotion. MS line. So this point is on the gallbladder channel. So we can use this scalp acupuncture treat emotion problem. Emotion problem. So this is, we can see scalp acupuncture is come from the base. The base is traditional Chinese medicine and acupuncture. This is talk about the scalp acupuncture or body up about acupuncture. So second, we talk about when the scalp acupuncture start. So we study scalp acupuncture with simple and the scalp acupuncture, the history. So before we know the scalp acupuncture is come from Chinese medicine, acupuncture must pass in the base. Chinese medicine, we know the history is so long, about 4,000 or 5,000 years practice. Over 2,000 in medical book. So we can see before we have Huangdi Lei Jing, this medical book. This medical book, but now so many theory, so many treatment we still use. So Chinese medicine, acupuncture, so history is 4,000 or 5,000 years. About the scalp acupuncture. Scalp acupuncture, the history is very short, only about 50 years. About 50 years. 1970, Dr. Sun Fajiao first mentioned use scalp acupuncture. This doctor first mentioned use scalp acupuncture, treat cerebral disease, and get good result. Sun Fajiao first mentioned scalp acupuncture. So then this article was published in a medical magazine in China. So this is an issue. This article. In this article, so he introduced his scalp acupuncture theory and make different scalp acupuncture point and how to use in a clinic. And he designed and made many charts many charts you see. This is Dr. Sun Fa Jiao weekly scalp acupuncture points. The front, the back, the side. Different scalp acupuncture points. Later we one by one study. This is Dr. Jiao first mention. So then use this chart, these points in the clinic use. So from this time, the scalp acupuncture is separate, become the new treatment from 1970. So scalp acupuncture separate from body acupuncture, become the new treatment, special therapy. So then first I want to remember this person first mentioned scalp acupuncture. It is called Jiao's scalp acupuncture. Jiao's scalp acupuncture is first show up the scalp acupuncture. So Jiao's scalp acupuncture is good for treat the brain disease. It's good for treat the nervous disease. Then and quickly used to in the clinic and go through the whole world. But now, many countries, many people still use scalp acupuncture, use Jiao's scalp acupuncture. NCCA test, some Christian still use scalp acupuncture, Jiao's scalp acupuncture. So you see Jiao's scalp acupuncture. So here have the front different area, front different area. So chest area, stomach area, reproduction area. So the back have food motor sensory area, and the second speaking area, optical area, and the balance area. This is Jiao's scalp acupuncture. So from side we can see the motor area. You see the motor area, the sensory area, coron traveling control area, second speaking area, or vertical theory area, and the third speech area. This side we can see different points, different points. Before we talk about it, so the scalp acupuncture is area or line. You see the different parts in the different, so all is use the area, give treatment, give treatment. So Gauss scalp acupuncture, since Gauss scalp acupuncture coming, used to clinic. So about 10 years. So then we have so many scalp acupuncture show up. So first is Gauss scalp acupuncture used to in a clinic. But the local have so many doctors. So he practiced about the acupuncture long time, and he has his scalp acupuncture. He has his scalp acupuncture. So for this, so you can see many scalp acupuncture show up. Many scalp acupuncture show up. So look like a Fang's scalp acupuncture. Song's scalp acupuncture, and the Tian's scalp acupuncture, and the Tang's scalp acupuncture, and the Zhu's so many scalp acupuncture. So many scalp acupuncture. Before I teach in the best tier, one students told me, say, so in California, she named from one doctor. The doctor have his scalp acupuncture. She said, so the doctor used his scalp acupuncture treat disease. Still have good result. Yeah. So we just this about the few scalp acupuncture. So in a clinic, so should be have so many scalp acupuncture. This is Fang's, Song's, Tian's, Tang's, Zhu's. This is mainly and popular scalp acupuncture. So in a clinic, have so many scalp acupuncture. We can see. So we say this is a Fang's scalp acupuncture. You can see different points, different points. So the body head in the center, in the front, you can see head, and then the whole body is go to the side. The arm, the leg, the different area. So the front, you can see head in the center, and the body in the side. This is Fang's scalp acupuncture. This one is Tang's scalp acupuncture. Tang's, this is different. You can see side, upper jaw, middle jaw, lower jaw. But this is Chinese. This is Chinese. I just show everybody. Tang's. This is Zhu's scalp acupuncture. You can see different. So the area, the line, the different area line, and they show different points. Different points. So this is so many scalp acupuncture. Tang's, Zhu's, Fang's. So many scalp acupuncture. So many scalp acupuncture is coming. So should be cause some confuse. What confuse? So for the teaching, we teaching which one scalp acupuncture. For the acupuncture doctor, we use which one scalp acupuncture. For clinic use, mainly what kind of scalp acupuncture we can use. Because many scalp acupuncture, which one we can choose, which one we can use. So this is have so many questions for the teaching. Which one we teach? So for answer this suggestion or question, WHO, Whole World Healthy Organization, in the 1984, opened the International Acupuncture Congress in Tokyo, Japan. Answer this question. So many countries or so many acupuncture specialists come into this congress. In this congress, the specialist did research, did comparison, did discussion, so say different than the scalp acupuncture. Good points, weak points, which one is more useful, have good result, which one don't have good result. So do so many research, compare, discussion. Then the acupuncture specialist with a new scalp acupuncture. The new scalp acupuncture, it is called the international scalp acupuncture. Today, we study, this is called international scalp acupuncture. So the international scalp acupuncture was made by WHO, acupuncture specialist. So the international scalp acupuncture so once made and was soon introduced to whole world. Can use the whole world and quickly used to in a clinic by different countries acupuncture doctor. So by now, many countries, many doctors use this scalp acupuncture is called international scalp acupuncture. In China, university, traditional Chinese medicine university, in a hospital, in a clinic, many use international scalp acupuncture. But some doctor, some clinic still use old Jiao's scalp acupuncture. But now, most is too popular. One is Jiao's scalp acupuncture. One is international scalp acupuncture. So for the doctor, for the hospital, for the traditional Chinese medicine school, and use. So now we need so now compare the new international scalp acupuncture with old scalp acupuncture. What is different? What is good points in the new international scalp acupuncture? Now we see the international scalp acupuncture. So the good points first. First, use the new code for scalp acupuncture is MS. That means first give scalp acupuncture points the name. The name look like stomach 36, stomach 40. Everybody know this is where. This is where. Give the scalp acupuncture the name. This is first. Look like M, indicating microsystem. S, indicating scalp acupuncture. For the future, so we talk about the scalp acupuncture points. We just talk MS. Look like MS1. If you do MS1 for the before, so this is middle line of forehead. You need to speak middle line of forehead. Compare with the MS1. Which one is better? Every people easy to compare. Easy to compare. So another, so it looks like MS6. MS6. So this is called anterior oblique line vertex and temporal. If you want to talk about these points before, you need to see anterior oblique line vertex and temporal. But now we use MS6. Everybody knows. So for this, it is easy to study, easy to remember, or easy to use in clinic. You can see WHO do this job. It's good. It's good. So second one, so then cover most old scalp acupuncture function or treatment. So many scalp acupuncture. So we choose popular scalp acupuncture 80 or 90% all have these points. We make. So look like MS2. So MS2. So this is for Jiao's scalp acupuncture. We have these points. Fang's scalp acupuncture. We have Zhu's scalp acupuncture. Yes. So the many scalp acupuncture always have MS2, the chest area. For heart, for lung issue, all have these points. WHO weak. MS3. This is for gastric area, for stomach issue, for the spleen issue. So all the all scalp acupuncture most have these parts. Look like Zhu's scalp acupuncture, Jiao's scalp acupuncture, Fang's scalp acupuncture. All have this. Then WHO make. So for this, we use MS2, MS3. So for the lung, for the gastric, so we can easy to remember the function or indication. So you can see WHO do this job. It's good. Why we need to study international scalp acupuncture? So because they cover most scalp acupuncture points. This is second one. 3. So we make international scalp acupuncture. We combine Western medicine knowledge with Chinese medicine knowledge. We know Chinese medicine so have 4,000 or 5,000 years. Medical book 2,000 years. But now, so the medical knowledge improve. Western medicine is very new, only 100 years. But we treat the disease, we don't care Western medicine, Chinese medicine, we just care good result. Good result. So WHO, so then Chinese medicine, Western medicine, combine. So look like MS7. MS7, this line is from the Do20 to gallbladder 7. This is long line. So this area in the brain, in the inside the brain. So from Western medicine, this is called sensory area. This is called sensory area. So then we use this area to treat sensory disorder. Sensory disorder. For Chinese medicine knowledge, so don't have a sensory point, don't have sensory area. But WHO combine, don't care Chinese medicine, Western medicine, we care is good result. We care is good result. So So from this, we see WHO did a good job. Use MS, given the scalp acupuncture name. So cover most scalp acupuncture points. So, and combine Western medicine knowledge and the Chinese medicine knowledge. We don't care, so Eastern or Western medicine. We care is good result. You ask a patient, is care so Chinese medicine or care Western medicine? Patient, I don't care. I care is give me good treatment. Give me good treatment. So this is about the so international scalp acupuncture points. So compare the old scalp acupuncture. So why is more good? It's more useful. It's more useful. So this is good points. Good points. So, but now we compare the old scalp acupuncture. International scalp acupuncture still have some weak points. Still have some weak points. So first, cannot cover the all scalp acupuncture points. Yeah. So this is easy to understand. Because so because the scalp acupuncture is from international scalp acupuncture is from the old scalp acupuncture. Is from the old scalp acupuncture the base, making the new scalp acupuncture. So this is international scalp acupuncture cannot 100% cover the old scalp acupuncture point. So now we see compare first one. First one, Jiao's scalp acupuncture. Compare the Jiao's scalp acupuncture. So, so the Jiao's scalp acupuncture have many speech area. Many speech area. Look like Jiao's scalp acupuncture have the first speech area, second speech area, and the third speech area. You can see this picture. Jiao's scalp acupuncture on the head, on the side, lower parts, on the lower parts. So this is speech area. This speech area. So international scalp acupuncture have the lower parts. So you see the back on the side or back. The second speech area. The second speech area. International scalp acupuncture don't have. And the third speech area. For the third speech area, international scalp acupuncture. Don't have. Don't have. So that means if you any speech problem, you can go back, look for Jiao's scalp acupuncture. Jiao's scalp acupuncture. Find and more speech area. Find more speech area. This is international scalp acupuncture and the weak parts. So another one, we can see Jiao's scalp acupuncture have two areas. It's called Korean trampoline control area. So you can see the yellow color, this area. So this line is on the motor area. Motor area forward 1.5 寸. Motor area forward, you can see the yellow color. Yellow color, this line is called Korean trampoline control area. So this area, so for what kinds of disease? So so it's called Korea. This is treat Korea disease. What is Korea disease? Look like disease the area in the brain. The people moving look like dancing. This is why, so so the Korean, these words from Greek words dance. You see the picture. The people moving look like dance. So that means this is a movement disorder. So the yellow color for the Korea disease treatment. Another, so this area can treat Parkinson's disease. Parkinson's disease is a trampoline. So we can use this area treat trampoline problem. Parkinson's disease is shaking trampoline. So another, so so the international scalp acupuncture don't have vasomotor area. What is this area for? Is blood vessels stretch or contract? So this can help the vessel, the function. So So this area in the Korea trembling control area, the front, you can see the green color. This area, green color, this area is called vasomotor area. Vasomotor area. So for this, so for this area, what for? Is for stroke. It's for high blood pressure. So for the stroke, high blood pressure. So if upper parts, for the upper parts, so from upper parts, you treat neck edema. So why is upper part treated neck edema? Because the people in the brain is upside down. Lower half parts treat edema of upper limbs. Treat edema lower arms. So from this, we know international scalp acupuncture have good points. International scalp acupuncture have weak points. So if we treat disease, according to different disease, we can choose different scalp acupuncture. Help clinic get good result. So now we take some break to 10:30 to 10:50. We start to 10:50.